The worst is over. At least that's what the Chinese authorities hope. Today, President Xi Jinping visited Wuhan, where the coronavirus was first detected and where the number of new cases has dramatically declined. Emergency hospitals are being decommissioned now, but physical contact is still discouraged.
You all wear protective suits and masks, so I can't see your real faces, but in my heart you are the most lovely people. Therefore, on behalf of the Central Committee of the Communist Party of China, I would like to express my sincere condolences and pay high respect to you.
Patients are being discharged. According to the WHO, China's aggressive response has brought success. The forcible lockdown of 50 million people and a restriction on social gatherings countrywide will be lifted. But what about the new surveillance techniques introduced to curb the spread? In Hangzhou, to enter a tower block, you need to have your temperature taken and registered. And you must have an app on your phone into which you input your name, temperature, recent travel and ID number. The information generates a color code.
In
Hangzhou, to go out of the community or to public activities, you need to have a green code. This green, yellow or red code is automatically decided through the system. It uses big data to decide whether you've been to affected districts or come into contact with those people.
But what if you're well and get a red code anyway? This man says he self-isolated while visiting Anhui province near Wuhan and back home in Shanghai. But there's no way to challenge the technology.
Our office building here, you need to register. You need to show the code to demonstrate that you're healthy. So when I was red, there was no way I could go to the office and work. I didn't do anything. Then after 2 or 3 days, I looked and suddenly it was green. I don't know why. But I think that although it's not really reasonable, it is still a preventative measure.
But few know exactly how their data is being used.
We actually looked at the back-end code that the app was running, and what you could see is the moment that a user gives it permission to access data, it immediately sends a function that says report info and location to police. And then we looked into it, and the police were a key developer of the product as well. And so from that you can tell that the data is basically being sent back to the police the moment somebody actually uses the app.
In some 200 Chinese cities, you now need a green code to get on public transport. Without it, you can do almost nothing. No crisis should go to waste. The coronavirus has given the Chinese Communist Party an opportunity to increase state surveillance, knowing that most people will be more worried about the epidemic than their privacy.
I'm not an expert, but if the government says this is useful, I believe them.
A Chinese company has now developed facial recognition technology that works even if you're wearing a mask. The epidemic has enabled the Chinese authorities to normalize digital social control, something they're unlikely to relinquish. It's been suggested that China's authoritarian leader lost credibility because of the initial cover-up of the epidemic. But in Chinese, the word for crisis is made up of 2 characters: danger and opportunity.
Lindsey Hilsum reporting. Well, now, earlier I spoke to the lawyer Nuri Turkel, who is from the Muslim Uyghur community, more than 1 million of whom are currently being held in camps by the Chinese authorities. I began by asking him how the coronavirus is affecting the Uyghur people.
The Uyghur people have been treated as not second-class citizen, but third-class citizen, at least as long as I have been breathing. I never thought that I would be talking about the way that my parents brought me to this world as much as I have in the last 2 or 3 years, because this oppression used to be bad, but now it's worse. And adding the current health crisis, we worry that if this virus makes it to the camp, we're talking about unthinkable casualties.
Because 1 million Uyghurs are
at least
detained in that
the United
camp.
States government estimates anywhere from 2 million to 3 million Uyghurs and other Turkic Muslim being detained in modern-day concentration camps. So, And to this day, World Health Organization or other international entities were not granted access to the camps to make sure that at least there's a health care.
Let me bring you then to this app that is monitoring people in the affected areas of China. You believe that, in fact, it is more than simply monitoring the health conditions of the people.
The Chinese government, before the current crisis started, the health crisis, virus crisis started, they already monitoring every aspect of Uyghur lives. So any movement, every movement that you made, even your door at your house has a QR code.
But this is reaching out beyond Uyghurs. This is anybody in the affected areas can be issued with this app.
So this country has already been deeply surveilled, and this new app is adding another layer for the Chinese government, Xi Jinping's China, to monitor their own citizens.
Then, effectively, China has become the first digital dictatorship.
This kind of things that you read normally in the science fiction dystopia, right? Today, the Chinese government not only using these technologies to surveil its own citizens, but also actively promoting that.
But then what you're saying about this app is that the medical crisis that is confronting China is actually enabling them at the same time to deeply penetrate digitally the activities of every Chinese citizen.
Right, that's exactly right. And also it's serving the political purposes of the state. Last year, New York Times reported that there are about 18 countries around the world, including Germany, surprisingly, already looking into the Chinese way of surveilling its own citizens, to make sure that there's no political upheaval cooking up. That includes the voting process or individual voting records.
But if the Chinese ambassador was sitting here right now, he would say, no, no, no. What this app is doing is enabling us to look at the medical condition of people suffering from this virus. It's a wonderful thing.
And then the same question be asked, why other countries, countries like UK, the United States, others, don't use that kind of surveillance to monitor the sick people? They put them in a hospital.
Thank you very much indeed for coming in.
Thank you very much for having me.